Back to school means back to being exposed to germs. We welcome Dr. Katelyn Mackenzie from Niagara Health to talk about ways we can help our kids stay healthy. Dr. Mackenzie, one of the things that I think we can start with right off the bat is if your child is showing symptoms, keep them home.
That's right, Mike. If your children are having any signs of respiratory illness, it's very important to stay at home, rest, have good hydration, and to return to school or their activities when they're feeling better.
Why do parents sometimes send their children to school even when they do have the sniffles?
It's hard for families. So there's lots of competing pressures, there's job obligations. Some children look quite well, but do have the sniffles, a bit of a cough, that type of thing. But we know in terms of viral transmission and spreading germs, it's very important to stay home if you do have symptoms.
We've already had some of those days where it was, about 10 or 12 degrees in the morning. By the end of the day, 19 or 20, some very big fluctuations in temperatures, and that's going to continue. Why does that complicate the matter?
Yes, our seasons are changing. We know in the fall and winter when the temperatures are cooler, that actually helps viruses spread and to be a little bit more hardy. We also know with the cool temperatures, just as human beings, we spend more time indoors and in closer spaces, and that helps the spread of viruses.
Two things that we really look out for during this period, RSV and flu. What is the difference?
You can only tell the difference by doing a nasal pharyngeal swab, but if you work in healthcare and you work with children, there are some other signs and symptoms that can help you determine between those two illnesses. RSV is known for having a lot of secretions, a lot of mucus secretions, a very wet cough, going on to have high fevers that last a few days or longer than typical, and also having labored breathing or wheezing. The flu, you can have all of those symptoms. You have a lot of fatigue, muscle aches. You just feel really run down. So those are a couple of the first symptoms that can help you distinguish.
Flu shots are available right now.
They are. September, October is flu shot season, and we do urge all families to get themselves and their children vaccinated and protected from the flu.
How can they do that?
They can approach their family physician, their pediatrician, or their local pharmacy. Usually if children are 6 months to 2 years, they get their flu immunization with their primary care provider, their family physician or their pediatrician. If they're 2 to 12 or above, some pharmacies do the flu shots, either in needle form or the live attenuated, the intranasal form in the pharmacy.
Are there shots available to guard against RSV?
There are for our youngest and our high-risk infants, usually infants that were born with respiratory or cardiovascular problems and were born prematurely. So there are RSV vaccinations for those infants. There are also COVID vaccines that we do recommend for children, and we know them to be safe and effective.
Washing hands during this season. We all learned a lot about washing hands during the pandemic. It's still important.
Very important, and it can be fun. You can, do the ABCs with your kids and challenge them to wash all the surfaces right to the end. Really important to wash your hands if there's a cough or sneeze into your hands or after using the bathroom, and just regular periods throughout the day. The other big factor to help lower virus transmission is just sneezing, coughing etiquette. So trying to do that into a tissue or the upper part of a sleeve, and if you have to use your hands, to wash your hands after.
Are we still seeing a lot of people showing up at the emergency departments for things that should not be expected to be treated at those places?
We do sometimes, and we do always urge families, if they feel they need an urgent assessment, don't hesitate to come in, but that is a big factor and it leads to long wait times. So if families have a child that are having mild illness, so runny nose, cough, fever, we always say try to give appropriate Tylenol, Advil, keep them home, lots of rest, fluids. If the symptoms aren't going away, to have an assessment in the walk-in clinic with their family doctor or pediatrician. If there's a lot of fatigue, their symptoms aren't getting better in a few days, there's signs of dehydration or labored breathing, that's the time to come to an urgent care center, an emergency department, or if they're really quite worried, to call 911.
We saw during COVID a lot of children were falling behind on their regular vaccinations, those scheduled vaccinations for measles and mumps. This has nothing to do really with this situation, but it's something that should be taken care of at this point in time as well, right?
We would really urge families to be up to date with all of their immunizations, including their primary series. And if they need any help with that, there's public health resources, a family doctor, their pediatrician. There's lots of ways to get up to date that are very accessible with their immunizations.
When it comes to knowing what to do in the case of signs of a cold, signs of RSV or flu, where can people turn to for more information?
We do have some really good resources on our Niagara Health website covering exactly this, back to school, where to go to access care. So that would be a great site to start with.
So stay home, wash your hands, and know what to do in the case of signs of flu or cold. Dr. Mackenzie, thanks for joining us today.
Thanks so much, Mike.